Welcome back. To complete our discussion on autism, joining me once again is Christina Newendorp, the Development Director of Autism Center of Tulsa. Let's jump in. Now, in our second segment, we were talking about and left off talking about these developmental delays and that you can actually detect some of this as early as 18 months. Tell us some of the things that we would notice or could sort of look out for.
Yes, there are a couple of great resources for any parents or health providers that might be watching this show that will give you lists of what is called a red flag in development. You can go to the CDC's Learn the Signs, Act Early campaign website. You could also go to a nonprofit organization, national nonprofit called First Signs, and they'll give you these helpful checklists to what is considered typical development. And then if you see any of these signs, then you should be concerned and should discuss this with your doctor. These sorts of signs would be things like any delay in communication. You should really be familiar with what an 18-month-old communications should sound like, what a 24-month-old should sound like, what a 36-month-old should sound like. How many words should a typical 2 or 3-year-old be saying? You should also be looking for joint attention skills. This is one of the huge red flags that we see in autism developmental delay. And that means the ability of a toddler to say, "Look at this, Mommy," or to draw attention to the same object. "Look at that airplane in the sky, Mommy, I see an airplane." If your child does not do that ever, or is inconsistent, that's a huge red flag.
So that's looking at the ability to see outside of themselves and what they may be thinking, that they're actually noticing other objects, the truck, the car,
and
those
most
kinds
importantly,
of things.
they're noticing that you have a perspective. Did you notice it? Also, look at me, watch me do this. And again, is an indication that they're noticing that Mom and Dad have a perspective and that they, you know, they're craving your attention all the time. One of the things we see with the children who are later diagnosed often is that they have reputations as being great babies. The parents, you know, just say, "Oh, my child was so calm and they entertained themselves all the time and they were content to play by themselves all the time and we just thought they were a wonder baby." Well, what is actually more typical is for a child to constantly be in Mom and Dad's face, you know, saying, "Look at me, I want your attention, do this with me." And so if your child is more, seems to be more remote, prefers to play by themselves, repetitive actions or perseverative actions where they only like opening and closing doors, opening and closing cabinet doors, lining up pretend play objects in patterns or rows rather than pretending to drive the toy cars is one of the signs that you'll see. So rather than you know, trying to describe those, I really want to direct people back to those official websites so that they can look at those lists. If they have a concern, it doesn't necessarily mean your child has autism, but it means that you should be talking about this with your doctor.
Right, and that gives us really a good idea of what we're talking about, because like you're saying, sometimes we want the baby to be as happy and content and quiet as possible, but that may not be what is actually expected and normal for that age.
That's right.
Now let me ask you about the other condition you mentioned that was started with the
PDD, NOS.
NOS, okay.
That is pervasive developmental delay not otherwise specified. And if your child receives that diagnosis, it means that they did not meet all of the diagnostic criteria for autism. They met some of them. And so it essentially means that your child has a milder form of autism. And so you have a lot in common with children who have autism and children who have Asperger's, but they're just 3 distinctions that the Diagnostic and Statistical Manual makes.
Okay, now with Asperger's, what exactly is that?
It's also in that family, that spectrum of disorders. A person diagnosed with Asperger's always has normal to above normal intelligence. So IQ testing is part of making that official diagnosis. And so a lot of times what we'll see is a child with Asperger's will receive that somewhat later at around 7, 8, 9 years old when IQ testing is more normed and more reliable. And that you'll always see the same sorts of behaviors with these children, that they are usually highly verbal, but have those pragmatic impairments. They don't seem to know when to stop talking or how to hold an appropriate turn-taking
the give and take kind of
conversation. And they often perseverate on certain subjects. They're often rigid in their thinking that there is a right way to do things and a wrong way to do things. They have a hard time with any kind of social flexibility, like winning and losing. They're very rigid about winning, and highly competitive children. And so again, these are traits that if you didn't receive appropriate diagnosis, you can get along in society with Asperger's, but it can create a lot of problems for the children who actually have this diagnosis, and it may be undetected.
Now, with this particular disorder, then, with the Asperger's phenomena, are those affected highly agitated, in that if they're not winning or it's not going the way they feel, they become extremely more agitated than what we would normally think, and so the reaction might be, wow, that was really over the edge, how they reacted.
Yes, we see anxiety often with most children on the spectrum, and it's particularly pronounced in those people with Asperger's. They're just highly anxious about the outcome of their activities, and they are preoccupied with the rules of whatever the activity is that they're participating in, and who's winning and who's lost. That rigidity is something that we see quite often, and it's a skill that you actually have to teach children on the spectrum, that life is dynamic. It's not static. We can't predict always what's going to happen to us. We don't have that control. And it's actually a skill that has to be taught to children who are on the spectrum.
Now, you did talk too about the inability to socialize and to play. So once again, early on, you would see children being very content to be by themselves and never really interjecting themselves in with other kids, because sometimes at young ages you'll see kids go over and they're not necessarily playing with them, but they're in the environment. They'll take this toy and they'll take that toy, and but this particular child wouldn't do any of that because they're not going to engage at all.
That's right. Child development specialists have way more expertise in this area, but from what I know about it, their children on the spectrum can engage in what's called parallel play. They can and do, but they don't seem to develop much past that. And around the age of 2 and 3, with typical children, you'll start seeing more of that turn-taking. Come and play with me. You be the mommy and I'll be the baby, in the role-playing type play that you'll see toddlers engage in. Help me build this tower together with the blocks. They really seek out their peers' company and their help, and I have this special friend in my my preschool class or my child care setting. And you just don't see that, unfortunately, with the children with autism. They just don't seem to have the skills to engage in that kind of play, and or maybe their communication is so limited that it's difficult for them to engage in those types of relationships. Okay,
now you were talking about in our last few seconds here, I wanted to sort of reemphasize. You were saying the earlier the diagnosis, the better the treatment and the better the outcome. So that this is a disorder, whichever type it is, where individuals can grow up to be functioning and contributing people within society.
Yes, and that is definitely part of our message, is that the earlier intervention starts, the better the outcomes. We have seen children who have received the appropriate therapies such as applied behavioral analysis, DIR floor time, relationship development intervention, those are all psychologically based approaches, speech and language therapy, occupational therapy, a combination of these approaches in addition to complementary alternative medicine. There are a lot of folks that are practicing that. But whatever you're doing, it seems that some combination of these approaches is what's enabling these kids to get so much better, and they are succeeding in school. Many are graduating and going on to college and university and going on to jobs and living independently, and that's what we want.
Thank you so very much for joining me.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments or questions or even suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/healthalertusa. Take care, and if you have any questions, contact your physician and get an assessment for your child. Take care. This program would not be possible without the support of OU Physicians in Tulsa.